study finds some dietary supplements could potentially harm you. That's according to a group of doctors and researchers who worked with Consumer Reports. Dietary supplements are categorized as foods or nutrients, so they're not subject to the standards and inspections of the Food and Drug Administration. So let's bring in Dr. Nina Radcliffe, private practice MD and anesthesiologist. Thank you as always for joining us. What exactly is the danger here?
Well, first of all, we need to understand that these supplements that we're using, manufacturers do not have to show that they're safe or effective in order to be used. And that's very different than when you get FDA approval for a pharmaceutical or prescription drug.
Yeah, and in fact, there are some doctors who are actually recommending some of these supplements for patients, and then there are tragic deaths as a result.
Right, and the tragic death that you're talking about was an 8-year-old or an 8-day-old that was in the neonatal ICU. And what they were using was a probiotic in order to try to prevent a deadly intestinal infection. So the benefit was that they want to prevent this, and that was their goal. And that's what many consumers want. They want a benefit like to fend off diabetes or to lose weight, but they are not aware of some of the bad effects that they can have.
Doctor, so many people are bombarded by various commercials, email links saying, stake this on your life because it's a great dietary supplement. It will help you lose weight. It will help you do this. All these great things. But yet, as you stated, the FDA doesn't approve of these particular instruments of supplements, I should say. So why is it not regulated more?
Well, that goes back to the 1994. There was an act that was put into place that they will not be at the same regulations. But this does not mean that as consumers we cannot have a role in what we do. Before you take a supplement, it's always important to do your research. And Consumer Reports has recently put out 15 ingredients you should always avoid, including kava and red yeast rice. These are some of them. So I recommend always doing your research. And whenever you're looking for something that helps you lose weight, makes you stronger, or maybe even enhances sexual performance, those are the ones that have some of the highest side effects. So I really caution against that. And before taking it, I cannot underscore, talk to your pharmacist, talk to your physician, because they may know some of the interactions that can happen with other medications you can take. Imagine you're taking a heart medication and the supplement that you're taking to help you lose weight or do some other effect can offset that benefit.
But one of the issues here, as I mentioned earlier, is that doctors in some cases are prescribing, if you want to call it that, these supplements. Does the medical community have to get more educated before they recommend, use a probiotic, use a supplement?
Right, and this is not generally across the board. There are doctors, we like to look at the science. In this situation, this is why we really need to scrutinize this. The doctors were doing this for a purpose. They wanted to prevent this deadly type of infection in this child. So as a result, they prescribed this. Now, that's why we need to look at this, and we need to understand that regulations are in effect to protect consumers.
So give us the best advice for people who are using supplements or want to get healthy and stay healthy.
Right. Again, do your research. Make sure you talk to your pharmacist. Make sure you talk to your physician. And just because there's a label or seal on there that says that's certified, it does not mean that it's safe or effective. This just means that the ingredients that are listed on there may be accurate, and then the amounts that they state are also accurate, and they do not contain harmful content such as lead.
And in some cases, not even all of the ingredients are listed.
Exactly, and that's what the point is. While no one likes to talk about regulations, when it comes to consumer health and safety, it is very important. Whatever we put in our body, medications, supplements, they can be powerful. They can damage our organs. They can even cause death. And I do want to point out, this is not an isolated case with this 8-day-old. The Food and Drug Administration, as well as the Centers for Disease Control, show that every year 23,000 people go to the emergency room for complications from supplements, mainly on their heart.
Yeah, Dr. Nina,
thank you.
Use your brain.
Exactly.
All right. Thanks for